I'm Dr. Sowmya, Senior Consultant Neurologist at Aster RV Hospital, JP Nagar, Bangalore. So we are going to talk about a very common topic, which is dizziness. All of us would have experienced at some point in life. And there are various types of dizziness. So it may be just, you're feeling a bit heavy-headed, or there's blurring of vision, or you feel like you're about to faint, or there may be a spinning of the surroundings, or you have imbalance while walking. So there are various causes of dizziness, but the term remains dizziness. So I think the causes can be as simple as generalized fatigue, to low blood pressure, to low hemoglobin, to more complex neurological conditions. So we chose to talk about this is that sometimes this dizziness may have a significant neurological concern which should not be neglected, and there should not be a delay in approaching for treatment. So when a person complains of dizziness, so we always try to find out what is the cause for the dizziness. So we talk to the patient, we try to understand what exactly they mean by dizziness, and then at what times, in what positions they have dizziness, what are the circumstances. And then a physical examination is done to rule out which system is affected. Is it the vision? Is it the vestibular or the balance system? Is it the brain? Is it the peripheral, the nervous system? Or is it the ear? So the examination is done, and then finally when we conclude, and then we may take the help of few investigations to come to a conclusion, and then the appropriate treatment is given. So as neurologists, we'll be seeing a lot of these conditions. What I want to emphasize is something called as vertigo. Now, when we say vertigo, it is a subjective or an actual spinning sensation either of self or of the surroundings. So it could be a very frightening experience for the person, because they feel out of control of their body, and they are actually very fearful. And it may be very prolonged, like for in hours together, or it may be very transient, few seconds. It may be repetitive, or it may be constant. So commonly this could be what we call it as a peripheral vertigo. Peripheral vertigo means that the problem is not in the brain, but in the connections from the vestibular system within the ear to the brain. So usually, there's a very common thing called as benign peripheral postural vertigo, or BPPV. So here the person typically has a postural vertigo, like whenever they change their positions, they may have giddiness. And otherwise, in the central causes of vertigo, they have a constant, it may be constant, and they may have difficulty in walking, imbalance. So there may be neurological causes, it may be a stroke, or it may be an ischemic stroke, or it may be a bleed, or it may be infections, or it may be tumors. So again, when it comes to neurology, central causes of brain, again there are various causes. So I think when you have these symptoms of dizziness or vertigo, and if it is persistent and recurrent, so I think it is important to identify that and seek care at the appropriate time without any delay, so that you will be able to have a proper diagnosis and proper treatment. Thank you.